Hello everyone. So in this video we are going to talk about electrodiagnostic test. As the name suggests, these are some diagnostic tests which via using the electro, that is electrical activity, are going to help us in diagnosing certain neuromuscular conditions. The first one of them, and an important one, is electromyograph, that is EMG. As the name suggests, electro, the electrical activity of the myo, that is muscle, plotted in the form of graph, is going to help us. Normally the muscle at rest has no electrical activity, so it will be plain graph. When the nerve is stimulated by a little current, there will be a little activity and the graph will be seen something like this. Okay, a specific crest and throw followed by plane, then specific crest and throw. This is seen because at low activity a small number of motor units are stimulated, and that leads to this graph. Consider a full activity when a high amount of current is given. So we have number of motor units in our muscle, and when these motor units are stimulated together, there is overlap between these motor unit, leading to an interference pattern. Okay, talking about the diagnostic modality, that is denervated muscle electrical activity. So when the denervated muscle, when the muscle is denervated, the basic understanding is that there will be no potential seen, because the muscle at rest was showing no potential when it was not stimulated by any nerve. But this is not the case. This is because there is an embryonic potential that is present in utero. Okay, this is suppressed normally in a person because of the nerve innervation by nerves supplying that particular group of muscle. But when this nerve supplies goes, this embryonic potential comes into action and denervation potentials are seen. These are crest and number of crest and throw followed by a plane, then number of crest and throws. This embryonic potential appears second week after the nerve injury, and if we see denervation potential, this is a bad prognosis because it shows that there is a complete transaction of the nerve. So what do we get by understanding electromyograph? Let's try to understand. So we get to know that whether the electrical activity that is gone in the EMG is because of a nerve injury or because of a myopathy. Because if it is due to nerve injury, we'll see specific denervation potential, which will not be seen in myopathy. A specific graph is obtained in myopathy too. Talking about complete and incomplete injury, in the case of complete injury, there will be complete transaction and denervation potential will be seen 2 weeks following nerve injury. Also, there will be no at rest, there will be embryonic potentials. The regeneration, how is it tested? So in serial follow-ups of the patient, we obtain EMG and we observe for the muscle which are showing the electrical activity. The level of nerve injury can also be estimated. How? We first test the proximal group of muscle followed by the distal group of muscle followed by the proximal group of muscle. So as the nerve start regenerating, we see the motor march phenomena. That is, the proximal group of muscle being regenerated first, and then the distal group of muscle regenerated first followed by the proximal group. So in same fashion, we go using the electrode. We first test the distal group of muscle followed by proximal group, and we look for the electrical activity in both the groups, and we will understand at which level which muscle is not showing electrical activity. That will help us in understanding level of nerve injury. So these were some things about the electromyograph. Let's try to understand about the strength duration curve. So the strength duration curve is a graph between the strength, that is in the millivolts, and the duration, that is in the millisecond. Before this, we need to understand two things. The first thing is, when the muscle is stimulated directly via the nerve, the neurotransmitter is released and then the muscle is stimulated. During this process, a very less level of millivolts of potential is needed, as in the case of action potential normally. So we need to give a very low potential. In the case muscle needs to be stimulated directly for muscle contraction, a large amount of potential or the millivolts will be required. So these were the two concepts, the nerve stimulating muscle or the muscle directly being stimulated, an amount of millivolt required. The two more things we need to know is Rho-base and chronaxy, the terms used in strength duration curve. So Rho-base is the amount of current in milliamperes, that is the minimum amount of current that is required to have a muscle contraction. Okay. Chronaxy is the duration that is required for muscle to be contracted rather, when the strength of the current given is 2 times the Rho base. Okay, mind you, 2 times the Rho base. So these were two terms. Now let's try to understand what this strength duration curve is showing to us. So increasing the muscle contraction, we can either increase the duration of our current, or we can increase the strength of our millivolts or the milliamperes. So normally when we start by 300 millisecond of duration of the current, and then we go below gradually to 1 millisecond. So normally when there is nerve is intact, okay, we observe a nerve curve. Now what is a nerve curve? When the duration of current is 300 millisecond, the amount or the strength of the current required is low, and even when we gradually go down, decreasing the duration of the current, the amount of the strength of millivolts required is still not too much. It is approximate same. Okay, so in the case of nerve curve, we see a flatter curve. In the case of the muscle curve, okay, when the duration of current is 300 millisecond, means the duration is high, so muscle directly will be stimulated, okay, because this is the high duration of millivolts. As we go down, decreasing the duration of the current, the muscle cannot be stimulated, as we already know that for directly stimulating muscle we need high volts of current or high duration of current. So since we are decreasing the duration of current, okay, for stimulating now the muscle, a high amount of strength of current will be required. So muscle curve is a steeper curve and the nerve curve is a flatter curve. The partial curve, that is in partial denervation of muscle, is someone which is between the nerve curve and muscle curve. Now, important point about stress duration curve, except for understanding whether the denervation or the muscle paralysis is because of a nerve injury or a muscle injury, is it helps in assessment of recovery. Now, how this is so? We'll look in the strength duration curve whether the curve is going flatter or the curve is going steeper. So if the curve is going steeper, means the re-innervation has still not occurred and we need high amount of current. And in the case the steeper curve is going flatter, it means the nerve is getting re-innervated and now the duration and strength are low requirement. The third thing is nerve conduction studies. In this, we study the conduction, the velocity of nerve conduction. Okay, we stimulate the nerve axon, and then using an electrode, will we observe when do we receive this electrical potential via axon. Normally, the electrical conduction velocity through the nerve is 70 meters per second. The electrode can either be directly placed on neuromuscular junction nerve or the muscle directly. This is an important test which can also help us in determining the condition like the median nerve compression at flexor retinaculum, that is carpal tunnel syndrome. So these were some bits about the electrodiagnostic test. Thanks for watching.